For e-prescribing of controlled substances to happen, doctors, pharmacies, and EHRs must first update their systems. The requirements for pharmacies are easier, so most of them are ready. But most doctors and their EHRs have some work to do before they are ready. For doctors, the amount of information and misinformation around the e-prescribing of controlled substances is daunting. There's everything from state laws, DEA requirements, and a long list of technology mandates. It's confusing to say the least, even for the people who work on it every day. To cut down on this confusion, Surescripts, the leader in e-prescribing, worked with industry experts to break through the noise and misinformation, to focus on the 4 key areas that are most relevant to doctors. This video will walk you through the 4 required actions needed for your practice to be compliant for electronic prescribing of controlled substances. There are also links to helpful information and tools on this website that will help you complete the required actions. So let's begin. Getting started with the first action step is easy. First, you need to find out if the EHR software version that your practice uses has been certified and approved for the electronic prescribing of controlled substances, commonly referred to as EPCS. You can simply click on this button to find your EHR status, or you can ask your health system's IT department or whoever is responsible for maintaining the EHR system for your practice. Once your EHR vendor has updated its software application and has been certified and approved for EPCS, it can be rolled out to prescribers within your health system. But keep in mind, you won't be able to e-prescribe controlled substances until the remaining action steps have been completed, so keep watching. The second required action step is called identity proofing, which means proving that you are who you say you are. Identity proofing is just like when you go to the DMV to get your driver's license. You need to prove that you are who you say you are, with proof like your passport, bills, and social security card. Your health system's credentialing office may take on this responsibility, but sometimes ID proofing is conducted online through companies working with your EHR. Check with your health system's credentialing office for their exact requirements. The third and most challenging required action step is issuing credentials for your two-factor authentication method. Two-factor authentication is something you do every time you withdraw money from your bank's ATM. Your identity is recognized with 2 factors, your card and your PIN. This is designed to make sure only you can take money out of your account. For electronic prescribing of controlled substances, this double-level process ensures that only you can sign and send the controlled substance prescription to the pharmacy. Two-factor authentication is the main difference to your workflow for e-prescribing controlled substances versus non-controlled substances. It can be done in many ways, using devices like mobile phones, smart cards, fob tokens, USB thumb drives, or even biometrics like fingerprint scanners. Once you're set up, doctors say two-factor authentication requires hardly any extra effort and often takes just seconds. Ask your health system's credentialing office, IT department, or medical leadership for guidance on credentials and the types of two-factor authentication methods they are considering. After you complete the first 3 required action steps, your health system is now ready for the 4th and final action step, setting secure access controls for your EHR e-prescribing software. Your health system credentialing office will send a list of prescribers who have completed their identity proofing and received two-factor authentication credentials to the IT department. Then the IT department will assign EPCS access and permissions to the prescribers. This is done to maintain consistency and provide a form of checks and balances inside your organization. For more details on completing access control settings, check with your health system credentialing office or IT department. After completing the 4 required action steps, you will be able to legally transmit electronic prescriptions for controlled substances. You, your patients, and pharmacists can now enjoy the added convenience, accountability, and security of EPCS. For a quick reference to the information and tips in this video, click on the video summary button. And don't forget, there are links to more details and resources. For information specific to your EHR application, always consult with your EHR vendor.